Now maybe we should talk about something else that gets a lot of attention is kind of draining people and how to
Mhm.
manage that. And what's your philosophy or thoughts about draining and how to get that sorted out for patients? Because you have a lot of patients travel in, as I do.
Yes. So I do drain. So I do drain in the capsular space because I want that space to close. If I do a breast lift, I also drain the area between the muscle and the breast. So I put in So if I'm doing a capsulectomy under the muscle and a breast lift, I do drain. I put in a, JP for the capsular space under the muscle, and I put in an axiom Y drain for above the muscle. And so in those situations, they have to be less than 30 cc's uh, per 24 hours per breast for me to take out those drains. Typically, we can take out the drain and fulfill that criteria between day 3 and day 4 of the post-op. People who are a little bit overweight, who have a big space, who have a rupture, they tend to take longer. But what I tell them is that, the drain does detox you because there's a gradient of chemicals that extend from your capsule to the rest, to the surrounding space. So if you're draining that, and that would include both fat soluble and water soluble liquid. So I tell them, if you're still draining a lot, that means that is good because we're detoxing. So those people, they stay longer, or they go home and they come back, or they just stay until the drains are out. And I don't want to go past a week.
Yeah.
So some, I just take them out even though they don't fulfill the criteria.